If you just feel overwhelmed, we'll soon have more to say about how you can access resources that can help. If you're in crisis, reach out, lean on each other, and know that we will get through this together.
And I thank all Canadians who have sent messages of encouragement and of positivity. But we can all do that in our lives to the people that are lonely and that are isolated. We can all send notes. We can all call those people that we know are struggling, or maybe even those that we're not thinking are struggling, to say that we're thinking of them.
It's been nearly a month since the World Health Organization declared a global pandemic. Days later, much of this country shut down, and millions of Canadians were told to stay home and socially isolate in order to curb the spread of COVID-19. We're now into the fourth weekend of that reality. Living in isolation sure isn't easy, and it can definitely be lonely. In an effort to confront anxieties in that isolation and openly talk about them, mental health advocate Michael Landsberg started Isolation Nation. It's a daily web show where guests discuss how they're coping during this time of social and physical distancing. To hear more, we've reached Michael Landsberg in Toronto. Hi, Michael. Great to see you. Great to have you with us.
Thank you for allowing me to share.
I wanted to ask you just for your general thoughts initially on the environment that we're in right now and what it can do to people who, or to anyone really, how much anxiety is linked to it.
Yeah, I think that there's two groups of people. There's people like me who had pre-existing conditions, who have experienced sort of the garden variety mental health battles, which would be anxiety and depression. And for people like us, it's complicated, right? Because it can magnify it. But also a lot of people who I've spoken to who suffer from pretty severe anxiety are going, hey, you know what's nice? The rest of the world now knows what I'm feeling. Because one of the challenges with having a mental health battle is that people can't understand it. And that's why the stigma exists, the belief that somehow people can get over it, or what are you worrying about? Well, now all of a sudden the rest of the population is finding out, hey, you know what? You can't stop yourself from worrying. So you've got two groups of people, the ones that have already experienced it, and then the ultimate newcomers, people that have never thought about mental health before and now are finding themselves in really difficult situation. I've been sort of searching for an acronym for it because I believe in mental health, everything seems to come down to an acronym. Mm-hmm. So I decided DOPE was the one, DOAP, depression, OCD, anxiety, and panic. It's like this mixture of not one of those, but kind of all of those. And it has people struggling in many cases for the first time on how to make sense and how to cope with something that is a big challenge.
And it doesn't really discriminate, right? Like you have so many different types of guests on your show. Yep. And we're all kind of in the same boat. No matter what we did before or how we felt before, everybody's kind of at least facing the same circumstances to a degree, right? Like we're all not supposed to leave.
Yeah. I mean, I think it's one of the few times in life that we have all fought a common enemy. You know, in World War II, obviously, in Canada, we all fought a common enemy, the Axis powers. But for the most part, nothing unites us 100%. But we are all battling this. We all know who the enemy is, and we're all affected, unless you're oblivious. And we know that there are people who are a bit oblivious, who will go on with their lives without really paying attention to it. But, I think lately people have been much better at socially distancing. So I just think that it's a rare bond that we all experience. And when I go outside to walk my dog, for instance, I always say hi to people, right? So I'm in general friendly all the time. But there's people now who are saying things that I've never heard speak before because I kind of feel like we're linked by this one awful thing. And in a lot of ways, as a society, it makes us closer.
That leads me actually right into my next question, which is sort of instead of solely focusing on the issue and the problem, how can we help people who are feeling that way? And what can we do to be better, more aware, I guess, of what people are feeling and therefore sort of address it more successfully?
Well, yeah, there's two things two approaches. Number one, you can ask, right, which has always been the advice when it comes to how can you be an asset to people around you who have mental health battles? And the question and the point has always been you need to ask how they're doing, and you need to go beyond the surface and really try to get them to open up. But I think the most effective way now, given the fact that we're all kind of experiencing it, is to say what you are experiencing it. How you are experiencing it, how you are struggling, because nothing empowers people to share more than hearing somebody else share. So if you said, hey, how you doing with this? And someone was, perhaps not wanting people to think of them as being weak, they'll say, oh, I'm doing fine. But if you say to them, I find it really tough. I find this battle against this unknown, this invisible enemy really frightening and really scary, and I'm not sleeping well, and I find myself catastrophizing everything, where in my head this is going to go on forever and the economy is going to be ruined and people that I care about are going to get sick. If you say that to somebody else, the chances that they will come back and say, oh my God, me too, are far greater than if you say, oh, how you doing?
How about, that actually made me think of kids particularly. I think I have 2 step-kids, and I'm always wondering, is this bothering them? Because it doesn't look like it is on the surface. What's your advice to us where kids are concerned? Should we be asking them how we're doing, and how forthcoming should we be about our own struggles?
Well, let me ask you this, how are you doing with this?
How am I doing?
Yeah, with COVID-19, how are you doing mentally and emotionally with something that, we're discussing it, and I'm not asking you that because I'm trying to switch the interview around, although I'm pretty good at that if I so chose. But my point is that your answer to that question can be actually the answer to your question, because how do you get your kids to open up? And I believe it's by opening up to them. So that's why I said to you, how are you doing with this? And whatever your answer is, I think would be really healthy for them to hear.
I think, like everyone, I'm feeling like it's pretty hard.
Yeah, and the best way to get them to maybe share with you is to expose more of yourself and, be more raw and be more open than you've ever been, because this time has never existed before, right? I heard somebody talking about, I watch CNN a lot. So I heard today on CNN that the suicide hotlines are dramatically up in the number of calls they're getting. I heard today that the suicide rate they anticipate will go up dramatically, and that has never happened before. And we are living in sort of this time that no one really has answers, which is part of the reason why our anxieties all get inflamed, right? You can't really be reassured by anyone. Who are you going to be reassured by? If the head doctor in Canada or the United States, if you say to them, are we going to be okay? The answer would be yes. And if you ask them, when will we be okay? How many people will die? How many people will get sick? They can't answer that. And that's really scary. And especially if you're a kid, that's really, really scary.
Yeah, I guess it's that lack of certainty, because we do know in general terms it will come to an end. It's a pandemic. The virus will play its course. We just don't have any certainty about that timeline and about the details that you mentioned.
Right. And we have no certainty on whether it's going to touch us or not. Right. Because if you don't know anybody who has been sick with the illness, or God forbid, but if you don't know anyone who has died from the illness, then they just sound like numbers. I remember writing a story after me and my family went to Juno Beach. This was 6 years ago. And we went to the Canadian War Cemetery. And I thought to myself, oh, my God, this is giving me a perspective on this that I never had before. The story of one person who died in the Holocaust, for instance, is way more powerful than reading the number 6 million. The story of one person who's suffering from COVID-19, who has a family, who has kids, who has people that depend on them for love and to exist. That kind of story, when a person like that is lost, that brings home to me what the tragedy of this is, as opposed to hearing a number, because we get desensitized to the numbers, right? At a certain point, they just don't mean that much to us.
Okay, I have to leave it there. I'm unfortunately out of time, but thanks so much, Michael. Pleasure to have you with us on the show, and thanks for the good advice.
Thanks for giving me the chance.
Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.